Mobility is important, and speed is really important. I think there are two sort of issues. One is being able to make a diagnosis quickly on a patient in front of me in real time, looking at a scan. Another really helpful feature is teaching. So you can actually take the iPhone to the bedside and show the patient, here's your stroke, here's what it looks like, this is what happened to you. Those are really two key features of the technology that will enhance our practice. I can be walking to the clinic and I'm talking to somebody on a phone, and I can go and look at the image without having to go and seek a PAC station to look at the image. It will be possible for me to be meeting somebody downtown. I can deal with a patient question or concern from somebody here at the time and carry on. I mean, the possibilities for improving multitasking are great. I can go to a hockey game, take my son to a hockey game, deal with a patient problem, and still stay at the hockey game. Any discipline where you need diagnostic imaging technology rapidly, that's going to make a difference. So stroke is a natural, or anywhere anybody who has to provide remote access. I can see it applying to almost every medical discipline, particularly, for example, for rural access. So you can imagine a situation where someone's way up north, they're in Yellowknife or north of Yellowknife, and they're not in a place where there's an immediate doctor, there's a nurse there, and they are able to communicate with you with technology, and you can provide expertise at the time for that patient at the time that they need it, even though you're not there. So it could apply to family docs. It can apply to, you can even do rehabilitation interviews. It could apply to surgery. If you're providing diagnostic information or advice to a patient, it can help any of those situations. Could be, really like the great equalizer, in the same way that we've talked about the internet as the great equalizer across the world, because there's clearly a distinction between remote and metropolitan access to healthcare. If we can provide that kind of diagnostic expertise in rural areas using technology, it will be really, really beneficial. I mean, everyone's first reaction is cool. Right? We're going to be able to look at these images on the iPhone, and I think most people have been very happy with the quality of the images. Most people have been very happy with that aspect of it, and then moving around the hospital, the people that I've talked to have been really think this is a really awesome evolution of imaging technology.